Hello, welcome to our Nephrology Fellowship Program here at HCA Kingwood Hospital, affiliated with the University of Houston. My name is Damon Cao. I am the Program Director and I recently take on this role. A bit background about myself is I developed a strong interest in nephrology toward the end of my internal medicine training, and I come to realize the strong interaction between the kidneys and the hemodynamics in the critical care settings. So I went on and did a dual trained fellowship in nephrology and critical care. Along my path, I developed a strong passion for graduate medical education as I realized the importance of proper training and development of our young physicians. And here I am hoping to make a positive impact in our fellows' education and training.
Hi, I'm Taylor McClure. I'm the Program Administrator for the Nephrology Fellowship Program here at Kingwood. I have been with HCA for 9.5 years and with GME for a little over a year. We have two fellows, Dr. Ephraim Demi, who is a PGY 5, and Dr. Sheriff Eunice, who is a PGY 4. We have a great space here at HCA in the GME suite, which we have a dedicated fellow space just for the fellows. And we have snacks and coffee and drinks available all day, as well as the cafeteria. We would love to have you here at Kingwood. We are looking for nephrologists to come and join us and become great nephrologists.
In our program, there are two training tracks. One is for general nephrology and one is for critical care nephrology. For the general nephrology, fellows will be undergoing 2 years of training, which includes the core rotation required by the ACGME, along with the elective rotations, which includes vascular with interventional nephrology, oncology with MD Anderson, and POCUS/critical care at our HCA facilities here as well as nearby facility. For research, there will be clinical research as well as other fellow activities with strong support from our faculties as well as the institution. In terms of nephrology critical care tracks, it will be a 3-year where fellows will complete the 2 years of gen nephrology and the 1 year of critical care, which will be integrated into the 2 years to make up the total of 3 years. The fellows will rotate in different critical care settings, including medical, surgical, neurovascular, and cardiovascular at our facility and nearby HCA facilities.
2021. I think what I really love the most about this program is the education. We've got a fantastic, well-rounded curriculum. We have every Monday we have lectures. We have journal club once a month. Our residents participate in pathology conference as well as virtual grand rounds through Methodist as well as Baylor College of Medicine. We have simulation lab every 2 weeks in a brand new state-of-the-art simulation center. And the research opportunities are endless. HCA is the largest hospital system in the country, so there's a ton of patient data available for clinical research, and our residents rotate through Prolata, which is a clinical trials company founded by nephrologists that does a lot of clinical trials in rare glomerular disease here in Houston. So I think fantastic opportunities, both education and research at this program.
So a few highlights of our program here at Kingwood. First, we have a very robust curriculum for point-of-care ultrasounds and integrated critical care rotation, the elective rotations, that allows fellows to have hands-on experience or training in basic scanning of the heart, the lungs, and the kidneys, which will add to our in-depth assessment of volume and hemodynamic status of the patients and allow us to make better clinical decision in terms of renal replacement therapy, diuretics, ultrasound, handheld ultrasound, which they can use during their rounds and assess volume status on the patients. We generally do a little bit of cardiac and a little bit of abdominal ultrasound just to look at the kidney as well. So during our fellowship training for the duration of 2 to 3 years here, our fellows will be doing about 2 months of rotation in transplant at one of the largest center here at Houston Methodist.
Hi, I'm Dr. Samya Putal Patu. Have been working at HCA Kingwood since 2009 and have been part of the program since it started. The fellows rotate with me in the hospital and also in the outpatient dialysis setting. They have a good continuity of care with our dialysis population. They come around every week while on their dialysis rotation. It's usually a block rotation, so they're there for 4 weeks. And during that month, they're involved in taking care of the dialysis patients and reviewing their labs and attending all the meetings, copy meetings. They have a good interaction with the multidisciplinary team while they're there. They also have a good group of home patients. They have both peritoneal dialysis and home hemodialysis. They also are able to interact with the biomed and learn about the different things, aspects of the dialysis clinic and outpatient dialysis needs for the dialysis patients, and also for them to be like future medical directors and be involved in the outpatient practice.
And one of the important things for a nephrologist looking for a training program is to see what they offer in the way of training in interventional nephrology. While many programs focus on inpatient care and acute kidney injury, a significant proportion of your time as a community nephrologist is going to be spent taking care of dialysis patients. And that includes knowing how to examine a patient's access, determine how well it's functioning, determine when they need to be referred to an access center, to have common knowledge of catheter care, catheter maintenance, fistulas, grafts, new access planning and placements, maturations, maintenance, salvage, so that these patients can get good, adequate dialysis. It is their lifeline. And I always had an interest in interventional work at that time. I was placing my own PD catheters, doing my own dialysis catheters, and fell into contact with one of my co-trainees who was looking for a partner in interventional work. We moved out locally to the Humble area, and we've been in practice here for about 15 years. And since that time, we've converted from an office-based lab into a full ambulatory surgical center. We're now 3 interventional nephrologists and 1 vascular surgeon, and we've completed over 40,000 cases in that time.
What would be the goals for a trainee who's going to comment?
I'm Dr. Rayasa. I am the Associate Program Director for Nephrology Fellowship in Kingwood Medical Center. I am associated with GME training since 2019. I would like to talk about the robust outpatient clinic setting we have in Kingwood Nephrology program. We have several clinics which our fellows attend under different attendings. We see a variety of renal pathologies, including variety of GNs, and we have several transplant patients we follow up as well. We try to make sure the fellows follow the same patient throughout the training, so there is continuity of care. I also want to mention about our business administration in nephrology curriculum. This curriculum focuses mainly on practical solutions for nephrology problems like joint venture discussions, dialysis center setup, and also management, and also medical directorship, the practical aspects of it. Our trainees also get a chance to see this dialysis center functioning in real time, and also they can attend some of the QA meetings. I encourage you to apply for a fellowship here where we focus on training holistic nephrologists and nephrology critical care attendings of the future. Thank you.